sincerely grateful to my colleagues. Okay. I'm sincerely grateful to my colleagues who could envision this program, this year-long celebration, for designing it and executing it. In execution, students and alumni, without whom I'm sure this would not have been possible. I also thank the Dean SSS for providing us the venue for this event. Thank you very much. Looking forward to Thank you so much, ma'am, for telling us about the history of the center. We will be hearing more from all of you today. Before we move ahead, I want to talk about how much ma'am has affected all of us. Not even the students who have not directly, learned under her. All of us have learned so much from her through her readings and through the professors that she has taught. So, as a small token of our gratitude, we would like to give ma'am a small token as this plant and a book coupon.
Public health in India, future of public health in India.
Wow, this is beautiful. Thank you. Thank you so much. The beautiful that thought. Thank you so much. Thanks every one of you.
With very, very sincere apologies, I want to acknowledge that I missed one of my very, very important colleagues, as I was mentioning my colleague, Dr. Alumni Sagar, who learned from ma'am and unfortunately is not with us today. Extremely sorry, Alpna, wherever you are, it was just an inadvertent error.
गुमराहों को राह दिखाते हैं कुछ लोग, जीने का नया ढंग सिखाते हैं कुछ लोग. And we are today celebrating those people who learn, who teach us to walk in different paths of life. Therefore, before we hear from Professor Imrana Qadeer about her journey, we would like to hear from her students, some of whom are her professors today, about Professor Imrana Qadeer.
We would like to invite Dr. Mohan Rao to start this.
He's on.
He has joined us online.
Turn around. Turn around and see. There he is. There he is.
Just give me half a minute. Delighted to be here, and I'm sorry I can't be in Delhi. I wish I was there.
Yeah.
Okay, can I begin?
Yes, please.
Okay. Thank you for asking me to be here. I'm very, very happy, and I wish I was there physically with you, but that was not possible. Memories are unreliable social scientific facts. There has been much discussion on this, on the epistemic status of oral histories. I'm actually not certain, but I think I met Imrana Qadeer in 1981. I had moved to Delhi the previous year and was working as a consultant at the Danida Healthcare Project of the Danish International Development Agency. My heart was not on this. I had heard of her, and a friend had worked with her husband, Dunu Roy, in Madhya Pradesh. He introduced us. I called her, and she invited me to meet her in her office in JNU. This was down campus then. We used landlines. So I took an auto and went there, and there she was, an ethereal beauty. She was wearing an off-white tussar silk sari, I think, and a white long blouse. I was dazzled. It was winter. Mentioned something about the sun being different in Delhi, and she looked puzzled. But we had a very brisk and dry conversation. She asked me what I had been doing after my MBBS and what books I had read and what I think that she should read. What a clever way to put it. She wanted to know what I sought to do. And when I said PhD in the center, she said, unbelievably, you're the kind of student we want. So I joined the pre-PhD program. Sadly, we did not have an MCH program those days. They came later. It was revelatory, it was hard work, but it was also infinitely satisfying work. Imrana Qadeer was a hard taskmaster as a teacher. Not only did you have to do the readings, but you also had to have a critical look at the methodology of the study you read, something I tended to skip. She was brutal in her critique of my term papers, but once said she would not discuss my term paper with me if I did not go to the exhibition at the National Museum. I suspect it was a rotten show that I did see later. He had been a resident of the Department of Pediatrics at AIMS when the visionary Vice Chancellor of JNU, G. Parthasarathi, having read something she had written, lured her to be one of the people starting the Center of Social Medicine and Community Health, and what a visionary journey this has been. Sorry, my phone's ringing. Soon she was also a friend, and that was a difficult relationship, but I was swept up and enveloped by love by her family, particularly her sister, whom I called Nani Appa, and her husband, Ziabai. They told me of their time in a communist collective in Bombay with Kaifi Azmi and his wife. My friend Anya Limba has a book on this collective called Revolutionary Desire, Women, Communism and Feminism in India, which Anya's parents were a part of. Ziabai told me once that he suddenly felt Muslim when he was on a neighborhood watch in the 1965 Indo-Pakistan War, when a neighbor asked him to leave. Ishan was the little boy I carried on my shoulders. None of them saw themselves as Muslims. They were Indians first, as Sabah Hassan argued in an essay in response to Ramchandra Guha many years later. And what an illustrious family it was. Imrana's brother is the famous late scientist Obaid Siddiqui, founder of the NCBS. If I am not mistaken, Obaid Siddiqui was jailed in 1952 for being a communist. He went on to win the Padma Vibhushan. Her brother-in-law is the illustrious historian Irfan Habib. I read a column of his where he wrote about how his passport had been withheld for being a communist. And when he won a scholarship to go abroad, Prime Minister Nehru invited him to meet him and restored his passport personally, telling him, go abroad, finish your studies, and come back and contribute to India, which is exactly what he has done to be called an anti-national today. I have been urging Sabah to write a family history. My little boys loved going to Imrana's house and be fussed over by Nani Appa. I got to know their daughter Sabah Hassan, now a friend, if a famous artist. I even owned 2 of her miraculous work. It was an open house, open to students, friends, neighbors, and indeed strangers walking in. If you stayed long enough, you could even catch a meal. Simple, nothing complex or sophisticated. Over the years I worked with Imrana in our center, it was very clear that we were colleagues first and friends later. This was a difficult relationship to maintain, but I suspect it was in Imrana's tolerance of her younger colleague that made it possible. We had our differences, of course. She could be extremely lovably batty. I once came upon her scolding her computer as Battamiz. Another time, I caught her trying to open the lock of her office room with a digital long-distance car key. Her reaction was typical. Le, you have one more story to spread about me. In those days, I looked forward to seeing 3 women faculty members in the beautiful saris they wore. There was also one ravishing male faculty member, Dipankar Gupta, whom I called a peacock. These three women were Imrana Qadeer, Zoya Hassan, Jayati Ghosh, all with exquisite taste that lit up spaces they entered. Imrana Qadeer and I worked on our critiques of neoliberalism and health and of reproductive rights, sometimes together, but more often apart, enriching each other. She had an intense interest in history, art, and music, something we shared. She's also a great dancer, as I discovered in some raucous parties we had at my place. She was also the kindest of friends. Innumerable are the people I know who shared their problems with her. 42 years later, she's still my dear friend. When we last met briefly in Bangalore a few months back, I gifted her an avocado plant that I had grown from seed. I hope that plant flowers and bears fruit, just as I hope Imrana's ideas do. Surely the world will return to a yearning for a better future. I'm so privileged to have known Imrana, since I know not too many people can say this after all these years. I'm so sorry I cannot be there physically for this event. I wish I could. CSMCH has meant my entire life. I was created there, and I hope I also helped to create some part of it. Nothing has given me greater joy than the classes I took and the inventive students I had who taught me so much. As doctors, we were not trained to write, and this is something that has haunted me, even as I see a lot of my social science students also hesitate to write. To have my students' book coming out now in these very difficult times, I feel like a very satisfied grandfather. They are Imrana's great grandchildren. Thank you all very much. Stunning silence. I can't hear anything.
Everyone is absorbing what you said. You need time.
Hi, Indra.
Hello, sir. Hi.
No.
Yeah. So the mic gave up on us for a bit. We're back right now. Thank you so much for sharing the stories that you did. As ma'am said that, लो एक और कहानी मिल गई share करने के लिए. We're very, very happy to hear from you. Now I would like to invite Dr. Ritupriya to share her experience with us.
Just speak from your heart.
Thanks, Shivangi, and thank you, Imrana, for being here. I'd just like to begin with a good morning message that I got this morning, which seemed to fit the day today so well. It said, memories are special. Sometimes we laugh, remembering the days we cried. And sometimes we cry, remembering the days we laughed. So that really is what we have with us for all these years that I've been associated with the center and with Imrana with Professor Qadeer. I just shared. That's where we are today, but I want to start at the beginning, when it was Professor Qadeer. And then we'll come to Imrana. I was recalling the first day I met her was early 1984, when I came to the center to find out more about the course, which I had seen advertised in the newspaper. And I came through some common activist friends. And so when I met her, I met a very, very stern face where I got all the information about the course, but also very strict warnings. This is about methodological rigor. Academics is serious business.
Yes, that was her favorite.
So that's not something that you can come as an activist and play around and just do some bit of activist and take a degree and go away. No. So that was the message I went back with that day. It didn't determine I would join. I came for the, applied and came for the admission interview. The interview was a panel of 4, I think, what I remember. Professor Banerjee, Professor Qadeer, Dr. Ramendra Swami, and Dr. Sahu. And initially I thought we were appreciative of the kind of response I was giving about the question they asked, why do you want to come here? So the critique that I had as a medical student and from what I had observed in the medical college and so on, I thought that they were sort of going along with me and nodding their heads. And suddenly, Professor Qadeer sort of perks up and says, looking at me, but modern medicine mein kuch to hoga. So it suddenly sort of made me stop, jolted me out of what I was saying. And again, gave sort of a warning of saying, you have to be realistic and grounded and balanced in even a critique that you make of the system. Those are 2 learnings that have stayed right through, because the classes that she took were also grounded in data, facts, readings, and yet so interactive that made us think and make us think critically and imbibe for ourselves whatever we thought. We could, of course, have differences with her and so on. Therefore, this guide, mentor has remained in that way through the years. She was the one who taught us. Professor Banerjee at that time was already at a phase where he would talk about the broad perspective in public health. And when you went to him with some writing or something, his response, his comments would be in very broad, sort of almost symbolic language. And just raise a few points, which would be very, very seminal, but you had to really just pick them up and understand them. It was Dr. Qadeer who made it operational for us in terms of, actually the nitty-gritties of reading papers as medicals with language which was very alien. So how to read them, how to translate them into understandable language for ourselves, how to analyze data, how to assess and study programs. All of this is what we learned from in a very grounded way from her classes. On to research methodology and the rigor that I had been warned about. And then later also about when the first international conference that I attended, which was the Cairo conference on sexual and reproductive rights. And we would go to there together. Imrana Qadeer was speaking and organizing an event, and I was to speak in one small one there. But the mentoring right there in terms of how to do that first talk which one had to give was something which was special, and she was right there beside me in that process. That's sort of the contribution she has in the academics of the center. Is I don't have to say anything about that. That's what all of you are already familiar with. But the other learning that one got from her was to practice what one believes in one's life. The fact that the way she structured her interactions in the center professionally and in her personal life was something that represented so much what she believed in. She gave her full to the academics and to the center. She respected dignity of each individual, whether it was colleagues or students or staff. Everyone received that from her. And she had a deeply humane approach to students and their constraints. And one learned of that even more when one became a faculty colleague, and all the discussions that we had as faculty about students, where that came out even more clearly. And then in personal life as well, she was humane and generous, almost to a fault. And there are several examples one can talk about, I won't. When I became a faculty at the center in 1990, she insisted that there was going to be no Professor Qadeer any longer, and no ma'am. So then she became Imrana Qadeer, and that's how the relationship has been since. I remember as faculty, all the lunches that we had together, where she attempted to bring together all the younger ones and We interact over lunch. We did that for several years. Walking back from the center in the evening, and then the tea and snacks, all the namkeens that we had with her and Duno in her house, Alpna also being there very often. And then the holy mornings where Gulal and Mithai was always there, and we spent several of the holy mornings with her, me and my husband. And Eid with Sivai. So those were all very precious days that we spent at her house, with Ishan running in and out and adding to all the fun. I think I stop with this. Thank you, Imrana Di, for being part of laying the foundation of the center, for making it a warm, humane place which encouraged and inculcated critical thinking rooted in academic rigor and humaneness. I think those are where I would want all of us to keep it that way and see how we can move forward on this legacy that Imrana Di has given us.
I think we can clap a little louder. That was a very heartfelt. Thank you. Thank you, ma'am, for sharing those stories with us, for telling us about your experiences. I would now like to invite Ramavaru ma'am to please share her experiences.
I think my two senior colleagues. The stories, as well as what Ritu said about the vision that she created for public health. I actually did not know Imrana till I came to the center physically in '85. But when I was a student of medical and psychiatric social work in the far-flung Thiruvananthapuram in Loyola College, and we were questioning the limits of social work as a discipline, the little college there had a library, and they subscribed to the social scientist. And I still recall that we read a special issue on health that was edited by Prabhat Patnaik, and where both Dr. Banerjee and Imrana had an essay. I don't remember the others. So I remember reading it very, very avidly, and this was in 1981. And very excitedly, we had a discussion in the group of 7 of us who were doing medical and psychiatric social work. And many of us wondering what we were going to do next. And at that point, everybody said, no, I think we should apply to Tata Institute of Social Sciences and go and do our MPhil and PhD there. But I was very clear that I wasn't going to do my MPhil or PhD in the discipline of psychiatric and medical social work. So anyway, my journey then went on to working with disabled children in the community. But I still somewhere had registered in my mind that if I ever do an MPhil or PhD, I'll go to this center. And it's very strange that it's only after about, I think, almost 6 years that when my husband moved to JNU to do his PhD under Prabhat Patnaik, that I first met Imrana socially. And we just started talking, and I said, I have read your piece when I was a student, and I really like the perspective because it explains a lot to me about how structural constraints influence individual decisions. Because a lot of the work in disability at that time was helping individuals help themselves. So then she said, why don't you think of applying to the center? Of course, it was a social meeting. She was, as Mohan described, most elegant, and I was taken up by her, and we had this very nice conversation. Then I applied to the center, cracked the test, and as Ritu described, went in for the interview, and I was petrified. There were these 5, 6 faculty sitting there looking very serious and asking me, why do you want to join the center? What is it that you want to do? And the very elegant and talkative Imrana, whom I met socially, said, are you sure you want to come here? You've been doing work in the area of social work. Why would you want to move to public health? Do you realize you'll have to learn some amount of medicine, understanding of what biology, etc., etc.? I said, yes, I have done my basic degree in zoology, and that's why I chose to do medical and psychiatric social work. Anyway, we were all down campus, as Mohan Rao mentioned, and we were a batch of 2. That was terrifying. Me and Rahman. Rahman is now a bank officer in Odisha. But he and I, and the nightmare was that when we attended classes, we had to do all the readings. There was no possibility of saying, okay, there are 4 more people who would also have read something of the article. No way. Directly under the scrutiny of Imrana and Dr. Banerjee also. He also taught us. But the one thing that I really, now when I look back, and I probably have imbibed some of that, Imrana, is that she was very, very tough with what we had to do. Whether it was our term paper or our readings, you couldn't escape. And one of the things she really helped me was, the 601 apart, her social sciences, the way she could weave it into public health. And I think she did it. She would walk into class, she wouldn't have notes, and then she would hold forth.
अगर ये पूरी कहानी गलत हुई तो मेरे घर में पार्टी होगी, थर्ड पर्सन भी गवाह होना चाहिए। मैंने बोला अगर ये सब गलत हुआ और मुझे थ्रेट दिया जा रहा है, मेरे घर में पार्टी होगी जिसमें लोगों को बुलाया जाएगा और दरवाजा के बाहर रचना का
really an art. It's not something you could be very well read, but to be able to do that was very difficult. And then I finished my PhD with her in an area which most people thought in my faculty was not relevant. And I remember going to Imrana, and I had moved to Hyderabad by then, and she said, you want to think about changing your topic a bit? I said, no, I'm going. I'll go join Osmania, but I'll do my PhD only on the privatization of healthcare. But she always supported. She said, no, we should break boundaries. We should look at newer areas. And you were a great support, Imrana, in that journey. And subsequently, I think we taught courses together. We had many friendships. When our daughter arrived, I still remember her coming and seeing us. We were living with my father. And my mother wishes you a happy birthday today. She was so excited that you turned 80. So it was a friendship. It was more than a friendship because she trained me to think. She trained me to be disciplined. So even in the other competing demands of life, the center was really an oasis for me. It was a place where I would escape to. It was a place where I loved my students, and all my students have really taught me much more than they can ever imagine. Imrana, I wish you all the best. It has been wonderful knowing you, and you have been a great mentor. Thank you so much.
Thank you so much, ma'am. It has been a lot hearing all of the stories, also because a lot of it are things that we still identify with, a lot of the parts that are coming together. We see a lot of ourselves when, we've heard similar stories from some of our PhD batchmates regarding the interviews. I would just like to thank all of you for sharing the stories. And now I want to, this reminds me a little bit, because we hear of people from different professions coming in together here. And essentially, a lot of us are following paths that were not very mainstream. And basically what ma'am has done for herself and for the center is also a path that was not very mainstream and well charted out right from the beginning. So it reminds me a little bit of what Robert Frost wrote. And both that morning equally lay, in leaves no step had trodden black. Oh, I kept the first for another day, yet knowing how way leads on to way, I doubted if I should ever come back. I shall be telling this with a sigh somewhere ages and ages hence. Two roads diverged in a wood, and I took the one less traveled by, and that has made all the difference. So on that note, I want to invite ma'am to share with us her story and the story of the center.
I don't know really where to begin from. And you have taken me to heights that don't belong to me. So let me bring it back to my level. I don't know if you have seen Kung Fu Panda. If you have, then I love a quote from Master Shofu, who says, yesterday is history, tomorrow is a mystery, but today, my friend, is a gift, and that's why it's called the present. So thank you for this gift today. Thank you very much. I was complaining that Mohan is becoming emotional. But so am I. Thanks, because I think it's really very valuable to sit and look back, to think together. Because every generation has its challenges. We had ours, you have yours. And I believe that yours are much more tougher than ours. Much more tougher than ours. And therefore, thinking together is very critical. And in that process, if knowing about our experiences as lost souls helps you, I'll be really happy to do that. I don't know how many of you have read. There's a document of this university, which I think got lost, which is about what the university was meant for. And then each center was given a mandate. So we all know that Jawaharlal Nehru University was conceptualized to translate the ideals of Jawaharlal Nehru University to create a body of knowledge which is guided by his philosophy of national integration, of secularism, of social justice, of internationalism and democratic way of life. Because it was thought that it is within this ethos that knowledge needs to grow in this country. And the university came as an act of the parliament. It was conceptualized.
I forgot to get
as a
that.
place
I left it home.
we will not teach disciplines.
Coffee.
They will articulate production of knowledge around problems. And that's how the university was structured. And the School of Social Sciences, not a single center, was oriented towards one single discipline. It's very easy to talk about interdisciplinary and boast about it, but it's very difficult to work it out. So each center
Tomorrow I will put.
tried, and can I have my water? Tried its best and did what it could. And the mandate that was given to the center was because the committee that was conceptualizing the center had decided that the subject of community medicine, as was taught in medical colleges, has really failed to address the problem of public health. And since the essence was the unity of knowledge, the conceptualization of CSMCH was based on integrating social sciences and medicine as equal partners. The mandate was that it will not be just the biomedical conception of community health, but it must be embedded in the social realities of this country. So, to embed it in the social reality and to make public health meaningful to the common man, to the people of this country. That was the mandate. Now, obviously, Professor Banerjee was selected to build the center. And as you know, he was a very eminent public health person. He had participated in the construction of the National Tuberculosis Program. He had worked in the Himalayas as a community doctor. He had worked at the National Institute of Health and Family Medicine. He had a whole lot of experience and ideas as to how he would like to build a center. And Professor Ramalinga Swami, with her background in social psychology, had worked at Nehai, and so she was also brought in. And then comes this totally ignorant 30-year-old to contribute to making of public health. Mm-hmm. And how did I come there? I have written about it. Maybe you have read it. Because my experience in my medical practice was very strange. I am a student of Patna Medical College, a college which has given me a lot because there was so much sickness, so much poverty that we as junior doctors had total freedom to do whatever we wanted to do with the patients who were at our mercy. It just so happened that one cared. And I don't know how many mistakes I must have made which nobody found out. But I tried my best. And I'm thankful to those children who helped me become a good pediatrician. I was a good pediatrician, I can tell you that. And from there, when I came to All India Institute of Medical Sciences, the contrast was so huge.
there I was, the goddess, everyone telling me, Dopsa, bacha ye ho raha hai, bacha wo ho raha hai. And I took decisions. I kept asking my consultant. I was very fortunate. I had an excellent consultant. He was very caring and he taught us a whole lot. Professor Gopal Sharan, one of the finest pediatricians I have ever known. And here, my goodness, to diagnose one thing which I could just look at and say, this is what it is. We needed this test, that test, and everything, so much technology. I was just flabbergasted. And then I got into my hands a pair of conjoined twins. And I looked after them for 6 months in the nursery. And I diagnosed that they had renal problems. We treated them, we cared for them. And the parents kept looking through the glass window at their babies. And they were so grateful to us. And then they were taken to the surgery department and separated successfully. They gained weight. They were kept in a very special room, an air-conditioned room, fed nicely. So 6 months in my care and 6 months in the surgery department. After a year, they were healthy-looking babies and sent home. Sent home, but they never returned. And we got to know that both of them died. And that was something which shook me so much. And there's another story, and I think I must share it with you. Before I joined AIDS, I was looking for where to go, Satyajani here or there. And I was taken as a registrar at, before I was interviewed and selected for my registrarship. A doctor there said that, okay, I have a project, the data is collected, will you help sort it out? So I had nothing to do with that, and I said, yes, I'll do that. So I looked through that data and I systematized it. It was about diarrhea in children. There was one of the data was that they were collecting the total fat content of the stool, and for that you need 24-hour stool collection. So obviously not all parents had done that, and I felt that the number of cases were very few, and I said that some of this is very small, so how do we make it a part of that? And he said, don't worry, just leave it out. So I did that work and I gave it to him, and I forgot about it because by then I was selected. I was in the hospital with my kids and I was happy. And some months back, when I was sitting in the library and looking through the Journal of International Pediatrics, I found an article. And it was the article based on the data that I had analyzed. And it had all the complete data there. And that day, I resolved that never in my life am I going to do research. Because I was young and I used to react very strongly. So these are the two experiences which brought me to jail. There are many more, but these are the two critical ones. That when I finished my maybe a third one, which again I have written about it. I wanted to work, after I finished my pediatric registrarship, I wanted to work in the project Poshak. It was a project by a very eminent woman to be run in Madhya Pradesh. And there was supervisory post of a technical person, and I applied for that. And she told me that, you know, it's going to be very tough for you because you have to travel a lot. And whatever we talked, I don't know, but I wasn't selected. And I thought that obviously she didn't find me suitable. It's only when in JNU I read about gender. And I realized that women could be as biased against women as men. Because, you know, they wanted a man who, to their comfort, be in the field and do the supervision. So anyway, someone, a very close friend of the family, told me about JNU, told me that this is the place to go for the likes of me, confused, not knowing where to go. So, like all of you, I also faced my interview with G. Parthasati and Banerjee and whoever daunting figures there were, and blabbered out whatever I did. They chose me. They chose me, and I got a room. And at that time, now it's all, you know, the quarters of employees in that area. But when I had joined the university, it was the cotton trees with red flowers and the reeds below. And for hours, I just looked at them, wondering, what the hell am I doing here? No patience, nothing to do. Just sit and read. And almost nobody to talk to because Banerjee was too senior. And he was, you know, he was a missionary. So he was so intense. So, you know, it was very daunting because I had very petty kind of questions. I was ashamed to say that I know nothing and where do I begin from? And one day, to help me, he gave me a task. And you know what he said? He said, you know what you should do? You go to the library and look up the census and draw a map of your district from where you come and blah, 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 some problem. My goodness, I had never known what the census is. I'm a poor pediatrician with my biomedical training. And I'm supposed to go and look up the census. My goodness, I tell you, for 2 weeks, I didn't sleep. I didn't know what to do. And to Ritu's point that I help everybody in looking at the nitty-gritties. That experience taught me that teaching shouldn't make things so difficult that the students run away. There has to be pleasure, there has to be excitement, there has to be fun learning. So we started building, interacting with each other. The early years for me was spent reading all kinds of books which I had not known, which I had not read. Learning about social sciences, sitting with the students. We always sat in each other's classes because that was the easiest way to pick up social sciences. So in Dr. Ramneswamy's class, in Dr. Banerjee's class, I was sitting everywhere. And Dipankar was a great help. He was there. At least one would, talk to him about one's limitations, lacunae. And over time, gradually, so if you think that there was a grand scheme and CSMCH started, no, it wasn't like that. We started with 3 people, totally diverse. And to see that today we are this big is really beautiful. And in the beginning, our courses were not as interdisciplinary as they are today. They were multidisciplinary. Because each one was constructing a course within their boundaries, but trying to reach out, trying to connect. So I was doing from child health, pediatric orientation, biomedical orientation, to maternal and child health. But trying to see how do I connect with what Dr. Banerjee or Dr. Amningaswamy are teaching. So we went through a phase wherein the courses were not necessarily interdisciplinary, but multidisciplinary. Immense interactions, and then gradually understanding how do I link. And if I link, then what are the areas in social sciences? And it was a very tough journey to understand how caste, class, gender, hierarchies, ecology impacts the areas wherein we are working. So through that, the social scientists identified the areas of where they need to focus. We recognize the linkages that we have to bring in, and 2 kinds of things. For social scientists, what are the courses that need to be developed? And the importance of developing a course which talked of integrated social sciences and application of social sciences. So you taught both basic social sciences, integrated social sciences, and application of social sciences. So the courses over time have evolved. There was nothing beautiful and grand. It's just that the faculty, the ones Sanghamitra has already told you about, invested their time. And I think because JU started as a university trying to create something new, its founders had visualized these problems. And so the university started with PhD programs. Now the advantage of PhD programs was that the students too were partners in this group. So it was not that they were just being given knowledge. They were actually equal partners. And I think that was very wise and very important. And that's why whatever the center has built, it is on the basis of contributions of its students and faculty. Now, as I told you that the initial years for me were a lot of learning. And then we started building on courses. I loved reading about social sciences, and I was very attracted by the fact that the science of epidemiology is incomplete without integrating it with social sciences. And my own experience was that in medical colleges, community medicine is taught as a second grade subject, only secondary to other clinical subjects. So it is less respected. And therefore, even students don't pay attention. We pass through the ritual, but we never cared about the discipline. And Park is very uninteresting. I don't know what all of you think about it. But when I reread Park later, it was very obvious why. Because the social sciences taught there are more about the kind of social work that is necessary along with public health. Never as asking what and why of the mortalities and morbidities that we talked about. So while in epidemiology, we always ask not just how much and the spread and the cause, but also how it will be questioned when you are doing malaria, tuberculosis, diarrhea, hepatitis, or whatever. But if you are saying that diarrhea is happening and in that area poverty is extreme, then the textbook will tell you that you need welfare programs to take care of the poverty. It will not tell you to ask the question, why poverty? And that was very obvious that it is only through the bringing in of social science concepts that you begin to answer those questions in the real spirit of epidemiology. So, to transform the biomedical orientation of epidemiology to social epidemiology, to the comprehensive notion of epidemiology of not just communicable diseases, but all problems, medical or social. There is an epidemiological approach where you bring in both streams of knowledge together. And I think that as a group, that's what the center has contributed. And that is the strength of our work. With this understanding, we started the MPhil program in early 80s, and we took students. And during this whole phase of growing up in the 70s and early 80s, we tried our best to interact with other centers. And there are lots of sweet and sour stories because we were doctors and the social scientists thought we know nothing, and which we didn't. I confess we didn't. But you know, there was an attitude that you don't know. And it was very difficult to fight that attitude. I mean, in board meetings, in CSRs, everywhere, there was that these are applied centers. You know? So we were there to apply the knowledge that they have created. We have very little to contribute. Some of our colleagues were frank enough to say in board meetings that there is a danger of diluting social sciences by having centers like ours. Some very senior people even said that if you don't have the disciplinary background, you cannot actually develop interdisciplinary sciences. But there were others who helped also. And I say thank you to all of them, without naming, even there are many, who helped, interacted, came and lectured. And they had difficulties because I know some of them said, how much simpler do I make it for you people to understand? And I said, I don't care, but my students are bright people. They are human beings and you have to communicate to them. Economics, history, sociology, whatever. And believe me, it wasn't an easy task. 2 examples, we had a course in statistics. A most beautiful person. He was in CSRD teaching statistics and he was so excited. He developed a course and he lectured our students. His delivery was so mathematical that for students, they had the privilege that you may or may not attend classes, it's all right. And by the end of that course, only I was sitting there. All students had graduated. And the same thing happened to philosophy. I was very keen because by the end of the 80s, when we were developing the course on methodology, I was convinced that, if you are going to bring different concepts from social sciences and put them together as integrated social sciences or as applied to public health, you can't just bring any concept because concepts have perspectives, philosophical basis, and therefore your selection has to be united at that level. And therefore, philosophy is very important. How perspectives evolve is very important. Which concept is being derived from which perspective is very important. So I was damn keen that our students should have the sense of philosophy. So I talked to a lot of friends, everyone showed much enthusiasm, nobody did anything. Coming from DU is not very easy, and at that time we didn't have philosophy. Then the moment we had the Center for Philosophy and a very eminent faculty joined, I said, you must come and do this. And he very easily consented and said, yes, I am ready. And poor fellow, he tried his best, but the fate was the same. So I know we have done a lot about the statistics, and now I think you have people who are handling that. But I know that philosophy is being relegated. And I know that unless and until you understand the importance of philosophy in your day-to-day life, this integration, this desire to make public health a humane discipline will not be complete. So my appeal to the faculty is to continue looking for those who can make philosophy accessible and not drive students away, who can show us why philosophy is critical in day-to-day life. The center over the years has developed a body of knowledge, a very critical body of knowledge. We have changed the face of epidemiology, as I just said. We have not only developed through our PhD scholars and faculty research, disease-oriented problems of malaria, leprosy, cholera. Rajiv's work on cholera is very important. Epidemics at NIAR, trauma, and I did. We have also tried and developed social sciences as it's relevant. Rama's work on international comparative studies of systems. Ramila, who has taken on the course of 601, the ever fattening course, Ramila, which you have tried to prune and share with others. So the whole approach to research methodology, interdisciplinarity in research methodology, and how do we proceed? It's interesting because those of us who come from the biomedical background, we are taught a notion of objectivity where you reach for the truth, and truth is absolute. So the natural sciences have this tendency of being seen as the hard science, because that gives you the truth. So if you look at the history of evolution of social sciences, you will see there are a lot of social scientists over the 60s and 70s have tried to follow the tradition of the natural sciences. So bringing in statistics, proving things, and following the pattern of biomedical sciences to prove themselves. I think things have changed. That was the time, early 70s, 80s, when this question about objectivity and subjectivity was being debated. And the fact that subjectivity is a reality and it has to be incorporated. So you can't get away by saying that I have done work which is objective and there is no subjectivity. Because after all, social sciences is nothing but human beings studying themselves. And if you are talking of social hierarchies and positionings, then perspectives in different hierarchies and different levels are going to be different. And those perspectives come into your conceptualizations, into your understandings. So you cannot get away from subjectivities. So how do you take care of that? And one lesson that I learned from my brother, the scientist, he said, he's taught me that you always question yourself. You have a finding, you question it. If you question it, you will be forced to collect data which does not necessarily prove your hypothesis. You collect that data, and then if it is falling within your conceptualization of the problem, no problems. But if it is not, then you cannot ignore that data. You have to rethink, you have to reformulate your conception, and you have to change your position. So the important thing was that you make your bias explicit. You make your subjectivity explicit while you're doing research. If you have said so, then your findings will take you forward. And then debate on your work is genuine because you have provided additional information that could have questioned your hypothesis to say that it does not question my hypothesis. And if it is questioning your hypothesis, then the other person has a right to say that you have to change. At the same time, defending your bias is also your right. So if you think that if I had yet another set of data, then I could question the criticism. I could take care of the criticism. Then you take your research forward. So bias in research is very critical because it helps you grow, it helps you think, it helps you change. And change is the essence of knowledge. So in research methodology, I was so taken up by this one single paper that I spent months together working on with my students. I hope you are still teaching it. Then the center developed this whole new area in the 90s and 2000 on political economy of health, privatization, Rama's work, inequalities that Ritu has contributed, Chanmitra's work, disasters, Smita's. I mean, all kinds of knowledge has been put together through the work of students and faculty. My first student was a Narayan, and he did an excellent work on looking at Kerala and the social determinants of health. And he was the first one to use the method of matrix analysis for taking multiple determinants to reach out an understanding for priorities in social determinants. And his work was highly appreciated by the economists themselves. His examiners were delighted. And my second student was Dr. Baru.
Rao.
Oh, Rao, of course. But Rao, wasn't he? Rao, Mohan. How could I forget that?
If he is there.
No, the point is he was hardly a student. He was my teacher. So that's why I miss always. The point I'm trying to make is that working with not just doctors, but social scientists was a great teaching experience. Now, having developed this body of knowledge, we were moving forward, and in this process, I think a very interesting thing was the pedagogic methods that we developed. I think the strength of the center was also in the way the GNU permitted us to structure our teaching programs. The fact that no attendance was required, I think it was a very, very important thing because it was a test for the teachers. It was a test because you can imagine what can happen if you aren't good enough. Then the fact that we had mixed classes, doctors and social scientists from different disciplines sitting together. I think it's very critical because each one is questioning the other. And the fact that our lectures were never really lectures. They were interactive debates, questioning each other. The furious discussions that happened were around gender. And people coming out with their experiences. GNU had a wonderful policy of providing points for disadvantage that brought in people from not just different regions, but also from different backgrounds. So when you have a student who comes with a background of living in slums, the quality of debate is totally different, because the experiences that they throw in our faces cannot but make you think and question yourself. So I think the multiplicity of the background of the students, the fact that we learn through interaction, the fact that, you know, you could just, I mean, if you people remember, all one had to do is take a problem and ask different students as to how they perceive it, and go on putting it on the board. And at the end of it, you find the most interdisciplinary perception of the problem. Because everyone has contributed to what are the different elements that are constituting a problem. So I feel that teaching in that fashion was really very valuable. Yet another very critical thing was that our courses were not just in isolation. We always tried to link up with the reality, and we tried to bring the reality through 3 levels of fieldwork. 2 guided ones, where we took them to the districts to interact with officials, with people at different levels of primary health center, district hospital, and so on. One, the urban visits, where you went to the slums and you saw that. And the third one, of the student doing their own detailed fieldwork. And all of this was brought into the teaching courses. And I think that's something which somehow you have to protect and take forward. Because in my experience, with these field experiences, students simply transformed, especially the ones who had never seen that side of the world. So it was a very critical interaction that the teaching in the center provided. And last but not the least, obviously, I think that it is very important that the faculty works collectively. We have to interact, we have to share, we have to teach and research collectively. One can be very good in your own area and grow horizontally, but growing together is a different experience. And I feel, at least in my time, I hope that you will have more such, and probably you already have such programs. The programs and the research project that we did with the South Asian Collective, wherein we worked on health systems, and we brought the book out on health. And the first project that Professor Banerjee did, and his book on health culture, poverty, health culture. Through that project, the faculty went into different parts of the country. We collected information together, we analyzed it together, and we learned, And I think that's a very important way of learning, of researching as a collective. So in short, what I'm trying to say is that we were able to develop a body of knowledge and create a certain period because of the opportunities provided by the center and because of the collective work of the center. And the center also did many other things. For example, interlinking with other institutions and bringing in people, interacting with them. Each one of us had come here with some interest, some background. So we were connected with people working, groups working in the field. So that experience, whether it was the group in Madhya Pradesh or in Shahdol or in Himachal and in this group in Maharashtra, the connectivity contributed. Me personally, I joined a group called Medical Friends Circle in the 70s. I've been a part of it since then. And it has been a great input in my personal growth. And I hope that some of you, many of you join that group and see how people like us are thinking and what kind of directions they are taking and how can we work together. The larger connectivities with institutions like WHO, EU, universities abroad, whether Cologne or Heidelberg or whatever, has also contributed in big way because they have contributed to our research programs, to our seminars. Now, the point that is important to remember that all this excitement of the 70s and 80s, gave us a feeling that, we are so creative and we are doing so much work and, we were in the air. But with the 90s, and let me also say that this was a time when we were also interacting very much with Compilation Commission, with Planning Commission, with the Prime Minister's Committee on NRHM. The center was invited, the center was heard, the center was somewhere contributing to the thinking process at the national level. And then comes the 90s and the structural reforms and the health sector reforms. And we, with our positioning, started critiquing, writing, thinking that, we will be heard. But over time, personally, I think that connectivity reduced. And new actors came in who started participating at that level, and not the center. The center, theoretically, conceptually, has contributed a whole lot on critiquing health sector reforms, what needs to be done, where we are lacking, if the initial objective of making public health meaningful to the people is still correct. But what is happening is that there are people and institutions who are ready to agree with the changed perception of public health itself. So public health is no more as we visualize. Public health today is something where technology is available. And all you have to do is raise your skills to use the technology and solve the problem. So over time, the indigenous notion of public health has been taken over by the public health notion of what is today called global health perspectives. And global health perspectives are basically being derived from you know where. It is the WHO itself. It is the World Bank. It is the Bill and Melinda Gates Foundation. And even the Lancet Commission. The Lancet Commission, which is telling us that, you know, all we have to do is identify the problems and the technology, and we are there to solve the technology with, to solve those problems within our lifetimes, their lifetimes, not your lifetime. See, they are so confident. And that's why I say that your challenge today is much harder than our challenge. Why? Because I lived CSMCH in the phase of state welfare, wherein the policy commitment was that they will build public. But over time, you see the transition. Even when NRHM came, the idea was that they will provide health up to the district, and they did make the attempt. It didn't work. It doesn't matter. But even NRHM left the tertiary care for the private sector. So the change had started then and there, and many of us did not realize it. And they kept thinking that this is a great thing. So what I'm saying is that the larger change of shifting from the welfare state into a state which is agreeing to the global health policies, which believes that through international health and importing technologies and injecting it into communities, we are going to resolve the problems of society, means that all my learning of social determinants of health is important. And therefore, what is happening today is that creation of this kind of knowledge is being undermined. And how do we survive? And that's the mystery part. Tomorrow is mystery. This attack has been dealt with in various ways. You know? So the essence was that we privatize, and privatization is going to provide healthcare. And privatization also, as Rama has shown in her work, commercializes the state public health services. They also become a mirror image of the private sector. So we privatize and we bring in technology and we forget about the social determinants. So your investments in health sector have gone down. And institutions which are talking of knowledge creation of this kind are getting undermined. Now, under these circumstances, how do you engage with the state? I think that is the challenge. So one way obviously is to join the Joneses and do what they want you to do. Some of us are talking about enhancing the pressure for regulation of the private sector. Some of us are saying that why should it be the state's problem to subsidize and regulate private sector? If it wants to stand on its own, let it stand on its own. We focus on the public sector. And some of us are saying that you can't take just one stand. You have to put your feet in both the boats, because there has to be a strategy of the weak. And let's recognize that we are on a weaker footing, because public health is a collective work. Public health requires resources. And building that knowledge, if you're in an institution, that institution must support you. And if you don't engage in whatever way, then you will be further marginalized. So how do you engage? And that's your challenge. And there are many people who are working on that. How do we work for greater regulations? How do we say that you cannot just forget about the primary health care, the universal health care that we talked about? So one is, how we take the challenge. And the other thing is the dynamics of this society in the neoliberal phase. I think it's very interesting. With the pandemic, there were a large number of states which came up with the policy that they will force the private sector to take up patients, provide care, and so on. They failed. And then there was a quiet. And today again, there are states which are talking about health as a right, and the whole turmoil that has come into the medical community because of the Rajasthan. It's a different thing that the entire doctor community is into this movement, is because most of the public sector doctors are also private practitioners. So obviously they're going to get affected. But the more interesting part is that, despite withdrawing resources from health sector, the states are realizing that they cannot ignore community. And that is where I see hope. That is where I feel that our kind of work has to be reiterated, has to be highlighted, and we have to engage in whatever limited way we can, while at the larger level, we continue to argue that it is the political economy framework, the larger political framework, which determines what is happening in the health sector. So what am I saying? Be a political person. Don't just say, I'm working in CSMCH and I am doing public health. Because I believe public health is nothing but politics, and you have to be very clear about your politics. I think that's since you started with poetry, let me read this. I love this. This is a poem by Pakistani poet Zahra Nigam. She's very famous. And its title is Ek Kahani Bahut Purani.
Oh, nice.
And it goes like, I hope everyone understands Hindi here. It's Urdu, but it's simple, it's famous. बारिश लाने वाला देवता इंद्र एक बस्ती से खफा था। उस बस्ती के रहने वाले एक एक करके मरते जाते, प्यास से चटके मैदानों में उनके बंजर सूखते जाते। इंद्र ने एक दिन ये सोचा, इस बस्ती में घूमने जाएं, अपनी खब्बी की ताकत का जाकर अंदाजा तो लगाएं। इंद्र उस बस्ती में आया, दुख की इस बस्ती की हालत अपनी कुव्वत पर इतराया। जाते जाते उसने देखा एक जौहर गदला गदला सा, जौहर इस पानी का, एक जौहर गदला गदला सा, जिसके पास एक भूरी चिड़िया बैठी हुई थी, ढूंढ ढूंढ कर एक एक कतरा अपनी चोंच में भर लाती थी, सूखे खेत पे डाल आती थी, हाँप रही थी, कांप रही थी, लेकिन काम किए जाती थी। इंद्र ने चिड़िया को देखा, खूब हंसा और उससे बोला, मूर्ख, तेरी इस मेहनत से सूखा खेत हरा नहीं होगा, तेरी इस एक बूंद से पागल कोई दुख अच्छा नहीं होगा। चिड़िया ने भी इंद्र देवता पर खूब हंसी और हंसकर बोली, तू ताकत के जोर में अपने सारे फराइज भूल गया है और मैं कहत की धूप में अब तक अपना फर्ज नहीं भूली हूँ। मैं मटियाली रंगत वाली बेबस चिड़िया अपना काम किए जाती हूँ, अपना काम किए जाऊंगी ताकि तुझको गैरत आए।
Thank you so much, ma'am. I'm still absorbing a lot of what was said because it was so vast and so much to learn there. So now we are going to move towards a question and answer session, an interactive session rather, with all of the students and alumni who are present here. If we immediately have questions, we can move to the questions. If not, if the professors are okay with it, maybe we can have a round of introductions because a lot of us are new here. So if we have 5 minutes of introduction of everybody.
Right? Or is there a question? They could introduce themselves. And then
yeah, or if we have questions, we can begin with the questions. But before you ask your questions, please introduce yourself.
Could we have a translation of the poem,
Online
please?
also, I see 37 messages in the chat box. If we can just have a look at the chat box.
Actually, you can read it.
Can we have a translation of the poem?
maybe, well, if you want to speak and start, if
Yeah,
you want,
I
and then
think so.
somebody can be monitoring, looking at the chat and see. Many of them are sort of
Just,
messaging
yeah,
each other.
yeah.
And hi. That you see, are there any questions? I think Mohan is raising his hand.
I saw one by Professor Rao
Yes,
saying
yeah.
translate the poem.
Can you translate the poem?
As always.
Dr. Rao,
Yes.
So could you, you can turn on your mic and speak now. We are open to.
No, I just wanted a translation of that poem.
Yeah, he wants translation of the poem.
Come on, Mohan, तुम्हारी हिंदी इतनी कमजोर नहीं है.
हाँ, बिल्कुल.
It's not Hindi. It's
Yeah,
not Hindi,
simple.
Mohan. ये उर्दू है. तुमको बहुत अच्छी आती है.
Just shut it up. In her inimitable state. She only can do it.
The center has said that the curd packets sold in Nandini in Karnataka should not say the Kannada word for curd, but they should use the word dahi. So we're facing Hindi imposition.
Oh,
No, but that has been withdrawn.
that has been withdrawn.
That's been withdrawn.
That's been withdrawn. I think you can start with the questions of the students, the alumni.
I invite all the alumni and students to begin the conversation. You can ask your questions for those online and offline as well. If you want, you can also put in your questions into the chat box. You can also directly turn on your mic and ask. That is also all right.
And it could be just sharing of experience.
Yeah,
It doesn't have to be
the
questions
questions,
to
yeah.
anybody specific. And just that sharing will be very valuable.
You can
Many of
ask
us
them
are
to
coming
share
together
their
after.
experience.
We are also looking forward to hearing from you about your experiences at the center and regarding public health. I see a lot of discussion has already taken place in the chat box.
Kaushal has raised his hand. Indranil, Kaushal.
Please go ahead. We can start with Kaushal and then.
Ask Kaushal to unmute. Kaushal, yeah.
Okay. Thank you. Namaskar, ma'am. So first thing for Dr. Rao. Dr. Rao said that it will please translate the poem in Hindi. Believe me, I was very, it was very difficult for me when I came to the center to speak in English.
Yes.
It was really very difficult. But fortunately, I learned. I was told to go to remedial classes to improve my English. But just one observation and one question. My observation, when I came out of the center, I realized that medicine was the easiest thing to learn, but most difficult to practice honestly and genuinely. And and as far as the social science is concerned, it was very difficult to learn. You have to have a very bright and critical mind, but easy to practice when you learn. So those things guided me whenever I became a part of a bureaucratic system later on. I never succeeded in academics, but I became successful in bureaucratic system. So, so from that, I realized that over the period, what changed, I saw that in the beginning, even academicians, the experienced planners were heard whenever you sit in the planning meetings. But presently, living in a very small country, I can tell you that Madam Qadeer said that Bill Gates Foundation, Global Health, and World Bank, basically, when they come, they basically engage these people, the academician, different experts, to just put a stamp on it that yes, this precise public health is important. So that change, how we are going to counter through how we are going to counter these approach in terms of the changing public health education. In these days, public health degrees are like we have some public health trained officers. They get 9 month, 1 month training, and they come and they practice public health. Number one. Second question is that in our undergraduate study, which is now changed quite different from what we were taught. It is just like a OSCE type, means that you have a structured training, you get it, and you get the humane feeling, humane touch of the medicine are lacking. So is there any say of public health in public health education. Can I say that our modern public health practice, how it will be, it is going to impact our education system in medical education, as well as what is, if Dr. Qadeer can, Ma'am Qadeer can tell us, guide us so that we can do this advocacy to change the medical education, to change the post-grad training in public health.
Sir, before ma'am responds to that, we would all like to get to know you because we're all from newer batches as well. So if you could just give us a brief introduction about yourself, since we are meeting, a lot of us are meeting you for the first time.
Sorry.
Tell him you're mute.
Sir, you're on mute.
Unmute yourself, Kausal.
Okay, yeah. Thanks, Habib. So I was Habib's classmate. So it was my 1994 batch. And I did my, we passed out in 95, sorry about that. 95 batch. And I did my MCS from there. Then I came to West Indies, Jamaica, and I am here as one of the medical officer of health for Paris, and working here for last 19 years. My primary interest was HIV. I did my fellowship in HIV medicine, and I worked in that field for more than 16 years, and then I was inducted into this post. So, anything else? I don't know. And I forgot to tell you, because now everything is in the system is like that, they need number. Even our behaviors are being digitalized.
Yes.
How we are going to address it?
Is the one?
Yeah.
Well, I don't think there are any easy answers to your question, because this is exactly what I was saying. The work within the center itself is becoming difficult, and I know it is, because it is becoming difficult in the university. And you know that the institutions themselves are under tremendous pressure to fall in line and do certain things. And therefore, to say what the center can do to change things elsewhere is easy, but I think first the center has to stay together and stand on its own. If the institutions themselves are to be influenced, then obviously the way is either through policy changes or
This is that one. Just ask them to.
Or through the institutions outside themselves being curious. I think in the earlier phases, a lot of institutions were not only interacting with us, but also they were asking for the structure of courses that we had created. And they were building their own structures, drawing from the center's courses. Now, therefore, a lot depends on the outside institutions themselves. And I think the first thing is that the institutions need to build up their libraries. I think the institutions need to build up the habit of reading outside the prescribed textbooks. Unfortunately, in most medical institutions, that is not the tradition. I don't know in your institutions, what is it? But if you can collect material that is being produced here and at least make it available, that is the least that you can do. And then if there are people who are interested and who would like to interact, I'm sure the center is open to that. At the level of policy right now, it is very difficult. But there is a debate going on medical education and the need to change. The direction of that change, however, is difficult to tell. And we have to see to the extent that the center can, I'm sure they will participate at the policy level to ensure that our perspectives penetrate to some extent in public health education. I don't think that in the early phases is going to be possible, but that is in the long term, that surely is a possibility. And I hope things will change.
Thank you, ma'am. If there are there any questions?
Indraneel had put up his hand.
Rashmi also had put up her hand. Rashmi Kumar.
Go ahead next.
Shall I? Am I audible?
Yes.
Yes, please introduce yourself to the people present in the room. Thank you.
Yeah. So, hello everyone. This is a very special moment, and because I fell sick last moment, I couldn't come. It was a big miss for me. I'm Indraneel. I teach at OP Jindal University, and I'm part of People's Health Movement Janswar Savyan. I joined the center in 2003, which is probably one of the last batches where Professor Imrana, along with Professor Alpana, taught 601, and maybe one batch later also. So one of the probably last few batches where we could really experience the thing. And I must say, while coming to the question on not taking too much time, when I came to JNU in 2001, when I was doing my master's, I could easily take the master's course easy, spend more time drawing cartoons, posters and politics. But when we came to 601, and you can't come to the class without reading, and that changed me a lot. So
traumatizing moment.
It was a big trauma. And the person who still, her presence still creates some kind of, I say, mixed sensation and pushes you to do things better, keep you always on, to push, to improve yourself. We heard from her and many other, my respected teachers. It was fascinating. And one very important, one question that comes to my mind, and you have reflected on the changes that we see today. No, and in your conversation, in Professor Rao, Professor Ritupriya, Professor Baru, everyone is saying you created this volume of scholarship together, learning from each other, and of course, taking us along in that journey. From that kind of, I think that era is, unfortunately, we are not going to experience in our lifetime. We would work in isolation, silos, in places more like where we have to contest for everything from ideology to principles of work. But and when education is becoming more instrumental rather than intrinsic value is missing. But then world is changing and our philosophy ideas need to also, as you have very correctly of course said, that needs to evolve and also speak to the time and keeping our basic core values and ideas intact. How do we come together? Because I think being alone or doing things in isolation, research can still be done in being in different places, but when it comes to teaching, building students, changing, transforming their lives, the outcome remains fairly limited, fairly what can I say, like the experience is very, very limiting. Is there a role, is there ways do you suggest we still, those who are in academics, and not to restrict academics by teaching, what can we do together? How do we come together, share our, when we create groups of faculties who are teaching in different places, it's for sharing information, do this conference there, share papers, it's all instrumental, but then the core things about what is so prime in our understanding about our ideas of public health, how do we retain, how do we develop that, how do we strengthen that? It is a question that bothers me a lot, and I wanted to raise this, share with you and get some insights from you. And don't know whether I made sense, but yeah, I'll stop.
Yeah, we'll take a few questions.
There's one question in the chat box as well.
Vyom.
There's one question in chat box.
Can you read out the question?
Yes, yes.
Vyom and Aarti also.
Yes.
We'll take a few questions at a time so that ma'am can answer all of them together. We've taken one from Imrana right now. We'll go to Vyom. He's waiting to ask, and then we'll go back to the online participants.
Ma'am, I am Vyom and I joined the center in 2016. Your talk was very wonderful, but ma'am, asking questions to you is very much because lots of my teachers were your students and I wasn't even born. So, ma'am, my question is, I have spent 6 years in CSMCH, and when I came here, I was blacklisted. I didn't know about computers apart from.
So was I. So
everyone was that, ma'am. But something which has been bothering me, I couldn't gather courage to ask, but I have to ask because it is eating me from inside.
Oh.
What I have observed is that social medicine is not something which was in the framework which was created in a conference. It came out of movements, it came out of movements in Latin America, the interwar periods, the military coup, Salvador Allende, whatever we have read. And ma'am, ये जो आपने बात कहा था बहुत अच्छा कि subjectivity is reality, and the biases in research is very critical. And how the social sciences addressing those problems जो कि हमारे यहाँ medical schools में जो toxic environment आता है जहाँ से लोग आते हैं और फिर इसको देखते हैं. लेकिन मैम हमको ये लगता है कि इस तरह का कोई मतलब पिछले 6-7 साल का कुछ वो था नहीं, मतलब हमेशा एक हायरार्की बना ही रहा था. मतलब हम लोग को एक एंजल्स पढ़ाया गया ये बता के कि वो वर्किंग क्लास है क्या दिक्कत होगा, लेकिन कभी भी हमारे यहाँ से कोई शेल्टर रूम का क्या सिचुएशन होता है ऐसा कोई रियलिटी नहीं था. सारे रिसर्च जो है मैम साइलोस में होते रहते हैं, ये एक प्रॉब्लम रहता है. तो मतलब इस प्रॉब्लम sorry, I'm digressing at all. और जैसे कि कहा गया कि it is not activism, you don't have to just criticize the government, but you have to be very vigorous. I think, ma'am, looking into the field and being active there is also informs our scientific rigor. Like we have been taught in that reading rigor in research and all. And तो मैम मेरा इसमें मतलब यही मानना है कि पिछले कुछ सालों में हम देखे हैं कि हिस्ट्री एंड ओरिजिन ऑफ सोशल मेडिसिन कंप्लीटली इरेज कर दिया गया है. अभी आखिरी आपने जो कोट बोला कि वो डॉक्टर बिरकोव का था और किसी को हमको नहीं लगता है ना बच्चे को बिरकोव कौन है पता है. तो ये सब मैम थोड़ा सा हमको ये सोच रहे थे कि कैसे हम बोले कन्वे करें, और ये सब क्वेश्चन पूछने का एबिलिटी मेरे टीचर से ही मुझे आया. उन्होंने मुझे इतना वो किया है कि हम ये सवाल पूछ सकते हैं आपके सामने। तो मैम बस यही था मैम, कहना था, हमको बताना था कि थोड़ा सा ये इस पे जरा मैम चुप कभी रिसेंटली नरेगा का, और उसमें मैम
Gerçekten kritik. Assalamualaikum sir.
I request those online to keep themselves on mute while you're not speaking. Thank you.
उसमें अलग-अलग स्टेट से अलग-अलग जगह से खेत मजदूर आ रहे हैं, जो कि मतलब खेतों में काम करते हैं, 210 रुपए की प्रतिदिन की मजदूरी होती है। वो मैम जनरल डिब्बे से रेलवे से सफर करते हैं, वो दिल्ली का डीटीसी बस यूज करते हैं because women don't have to pay for the tickets. They go and live in the shelter homes and गुरुद्वारा। और मैम जब वहां पर एक नरेगा जैसा पब्लिक वर्क प्रोग्राम में ये चीज खड़ा किया जा सकता है मैम, तो वी आर वेरी पावरफुल पीपल। यू गाइस आर डॉक्टर्स आर द मोस्ट पावरफुल पीपल, व्हाट बोला जाता है। तो आई डोंट नो, आई डोंट वांट टू साउंड लाइक वो एक्टिविस्ट टाइप और ये सब टाइप, बट आई थिंक this also is required in the scientific research, the history of our social medicine and the social perspective research which we acquire, which has been erased since last 6-7 years। हम लोगों को ठीक से समझ में कोई नहीं कि क्या होता है, वो तो बाद में 4 साल 5 साल बाद किताब पढ़े तो समझ में क्या चाहिए। I'm sorry if I said anything.
He's read that paper.
Thank you, Vyom. I think we can take one more question online, and then, ma'am, if it's all right, we'll pass it on to you. I see one person has raised his hand. Immaculate Mary.
Yes. Can I read?
No, she's there online. She's online.
Okay. Okay.
Happy birthday, Imrana ma'am. It was so lovely listening to you and all the professors. In fact, like I'm from 2002 batch. I'm from the social work discipline. For me, the entry to the CSMCH helped me to redefine health, redefine poverty, and look at the quality of life. What are the determinants? So I have 2 questions for you. The first question is, what empowers people to take care of their own health? Does access to quality education be the crucial determinant to improve the quality of life? Because after being with the center, I started working for the last 2 decades, children in the marginalized communities. I really feel that the perspective which you shared, the critical questioning, the ability to question, it comes with the ability to access the right quality education. So I want you to share some perspectives on that. As a preventive approach to public health, how do we determine working with the young children living in the poverty right from the beginning, and what kind of suggestions would you give for the social scientists to do that? Thank you.
She's introduced. नहीं, मैम को बोलने दो। 3 हो गए।
Because I see Amitabha has put in the chat box he's unable to raise his hand. So you can go ahead and introduce yourself and ask the question.
Sorry again. Hello, ma'am. Amitabha here. Thanks for this opening day lecture. I'm unable to, I don't know why my video is not working. It's a old laptop, in fact. So I moved last year to Geneva for a postdoc opportunity. I am right now with the Global Health Center at the Geneva Graduate Institute. For others, I mean, I completed my PhD in 2020 with Professor Rao and Professor Baru. And I'm also excited because I'll be joining the next week celebration in person there in Delhi. I'm coming actually next week. Ma'am, so my question is that, sorry, I'm unable to put on my camera. I don't know why. My question is that, ma'am, while in the public health discourse and discussions, the history of public health, it is always stemming from a perspective of state control or state planning mode. So even till that, so intervention and the planning, management, operation. However, what we learned during our courses, discussions, and of course, the JNU environment, the CSMCH environment, and even we aspire to practice the same till date. The people's understanding their own nature and their own democratization of public health in that way. So do you think, ma'am, that there is an inherent contradiction between these two, what we actually always try for, and the origin of public health and how it has become a part, and it is an integral part of the bureaucratic structure? So this contradiction will remain, or there is some form of other understanding would be possible even in the future to make public health set aside from the state planning, or rather people's planning. Perhaps it's an ideal deliberative democracy, but I just thought to share this. Thank you, ma'am. Thank you.
Okay. First things first, one, I think it's unfair that I should be responsible for all questions. It's the group that is responsible for answering all questions. But I'll make a beginning. I think the last three questions together, the question of the missing history and field experience and its importance in public health, the question as to what empowers people, Mary's question, and the last one, that it's from above. I think I ended by saying that public health is politics. And what is politics to you? Is it making more money, getting a better job, having a family where kids can be sent abroad? What is politics to you? If politics is the appropriate use of power, then what is the appropriate use of power? These are questions that we have to answer for ourselves. And if you believe in public health, where we organize services for the betterment of health of the people, and not just medical services, but all services, and that's how social determinants come in, then health services alone are not the answer. Then you have to talk about nutrition, you have to talk about employment, you have to talk about education, transportation. Women die because they can't reach the appropriate places. So, I really don't know why we are asking these questions, having been through CSMCH. Because you know that what is the responsibility of the center? Will the center become a political activist as a group? No. Sorry. The function of this center is to create knowledge which is meaningful. To what? That is for you to decide, and you have already decided. If you have already decided, then as individuals, we have two challenges. One, to define my politics, and two, to find space for academics in that politics. A good politician of JNU is a good academician. Let me tell you, you look at history, you are talking of history, you look at all the presidents of Jawaharlal Nehru University Students' Union, and you find out who they were, what was their politics, what did they do, what did they fight for. So don't ask me this question. And you are free to get involved in field, to get involved in movements. I thought that is what I was saying, that the beauty of the center was that through its field work, we structured the program to bring in the outside into the center, to bring in
experiences of all kinds of people into the center and build upon that. And I don't know, but I thought that building the history of social medicine was very much a part of the courses in this center. You see, the trouble with us is, I tell you what, that over time, the force of disciplinary education, going back to disciplinary education, is becoming more and more, and interdisciplinarity is being undermined because it is more threatening for the larger powers. And our courses, we took as students and we said, sorry, you may be a master's, you may be whatever, but you have to go through these courses, and without it, you cannot do your PhD. And so all kinds of the students with very important degrees came, but they were forced to do courses. And so we had a 3-semester course. Now, I don't know to what degree it has been reduced. So the point is that for teaching, you have very little time. I had the privilege of having a lot more time to interact and to teach students. And history was a very critical component of 601, and later on it was taken by other courses and still continue to be taught. So to say this is missing, that is missing, yes. But you also have to see that the challenge is that in the shrinking spaces, you have to teach core areas, and if the faculty is able to sensitize you, then it is your responsibility to study history. Study history as bedtime story. Why does it have to be taught as, coursework? So many interesting books that you ought to be reading. Man's Worldly Goods. I don't know whether you have heard the name of it. Scalpel and the sword. Have you read that?
You can
These
say.
are all history, the stories from history.
They can say.
So,
you can say. I can
reading,
You can say.
nobody stops you from reading. And if the course has sensitized you to the importance of history, then it's your responsibility to study history. To Mary, and to the question of public health being a state thing. See, this is what I'm trying to say, that wherever public health emerged, whether in Britain or in Canada, wherever, yes, it emerged from the working of district hospitals and clinics and the importance of understanding how diseases change in forms in communities. But learning from all that, welfare states decided to make it their responsibility to organize and ensure that people get those services. So the point is that if the policy is such that it is going to provide services, then public health comes from above. Then it is the responsibility of the state. But it is not necessarily always so. There are all kinds of political formations. So public health does not die. But the challenge is to ensure that the civil society and communities have the strength to ask questions, to demand. Today, are we making our civil societies capable of expressing needs even? Forget about demands. So what's wrong with the system? So it's very easy to say that public health is taught only as above. Suppose it was from below only. Then will you stop by saying that, okay, in my mohalla, I will ensure that malaria doesn't happen. You cannot do that. You will have to work with the neighboring mohallas to ensure that malaria doesn't come there. So even if you are building public health from below, you will have to come together, you will have to develop larger systems. So the challenge of public health is that you begin from wherever, it requires larger systems to operate. And that's why systems analysis is critical in public health. You can have a very good movement, but in that movement, if some totally biomedically oriented doctor is sitting and providing pills for everybody, and you are very happy that, my medical care is being taken care of, is that good public health? No, it is not. So can communities collectively provide the integrated services? Can communities together provide education to people to have the information, to be able to ask? That is possible only within a political system that takes it as its responsibility to reach out to the lowest in the society. So you have to have a double-edged struggle of the political system, which will reach out and not appropriate, and to a public health which is more sensitive. You can't have it any other way. And that brings me to the real question, and I wish that all those people who are online and are now senior in important positions share with us the kind of challenges they are facing. Because it's not easy to practice what we preach. And so the question that Indrani is raising, he is working in a very eminent institution, but he's feeling so alone. And I think that's a very critical challenge, so isolated, so incapacitated, and so depressed. But we are not making the effort, including myself, maybe, not making the effort to reach out, to connect, and to see how we can work together. When it comes to policy, we say, why 1% health finance? Why not 3%? Why not 5%? Why not 6%? I ask myself, if I am interested in connecting, in working together, why am I not creating the resources needed to connect? And why am I not saying 3% of my earning goes in this? Nobody is going to create a situation where you will be brought together on a platform and said, now you do public health. No, sir. We have to generate our resources. We have to make the effort of coming together. And we have to do the kind of work that we want to do. I mean, let's ask a genuine question. Those of us living in one city, what effort are we making to come together to at least interact, to say what we are doing, where we can go? Nobody has answers today. We are living in a very difficult, interested. Are we making the effort? And we have to. There is no way to take this kind of public health forward unless and until we are ready to make the sacrifice.
Sorry, and there was regarding medical education. I medical education. Didn't I say that? I answered that.
Said it.
No, caution has something.
Answer here.
I think there are a couple of questions from the room and online as well.
So, but I don't have a one-liner question, so I would like to have a dialogic mode of communication with the speaker. It will take me this time, a little more time, I guess. Yeah. So, I'd like to sit here.
Yes, please. Please introduce yourself. Yeah. Thank you.
Hello. Yeah. Am I audible? So my name is Ankita, and I'm currently doing PhD from this social system department here in JNU itself, and I'm a third-year PhD student, and I'm coming from the state of Bihar, and I'm making it very loud and clear because my research work is based from that space, and I'm trying to look into the riparian community in the Kosi River Basin. And while I was preparing this proposal, I also had an interview communication with this department itself, and where I was looking into epidemiology and how epidemics impact certain districts of Bihar due to Kosi floods. So then this very department title, it struck me, Community Health and Social Medicine. So I was looking like how, apart from the biomedical people who look into the biology of things, how are we going to see this in terms of medicine? Like I'll be talking in a very philosophical talk because I don't have that kind of yeah. So like, how do we see social medicine and community health as a social like as something beyond, apart from biomedical? So one thing that I would like to bring to the table is what is that which is impacting larger number of people in a particular space, in a particular region, like floods come and epidemics happen. So when we are dealing with public health, it is also very important to see the major determinants. And as the speaker in the very beginning, she talked about the dynamics which are there in play, like caste, class, gender, along with ecology, which then I found very much missing. So I thought of bringing this to the table, that it's very important to also give attention to the factors like air, water, land, and the other ecological factors that are impacting a spatial reason in a particular place, and that impact the community health of that social space. For example, to make it simple, like one person might have a disease because of some kind of something, but if larger community is facing it time and again, so it's also it also comes under this ambit of knowledge system, which interdisciplinary kind of a departmental thing, where we try to look and see into the ecological social factors that impact community at large. So yeah, I'd like to talk about that.
Well, I thought I did mention ecology, and I think that's been a area which we have explored in the center along with the CSRD department. And there were people from CSRD who worked in the center, like ecology of malaria, and much publications have been made. So I couldn't disagree with you. It's very important that the physical contours are taken into account when one is talking of epidemiology. There's so many diseases, whether you have filaria, how it is linked with different humidity, water, or for that matter, pellagra in Bihar. It's why is it located only in certain areas? So yes, I agree. It's very important.
Yeah, and how it impacts the larger, like when we talk about public health, it's also like intergenerational, and what are the things that are coming up from a particular space. So like I would like to shift attention to ecology and space, how it becomes very much important when we talk of this policy making and all these things.
Shifting focus, actually you shift focus through your work. Okay, everyone will decide where their focus will be. And there are some issues where ecological factors are very critical. There may be some issues where they are not that critical. So in a hierarchy of causality, a researcher has to have priorities. So which is most important? If somebody is working on organizations, etc., then it may not be that critical and they may have more facts. But if someone is talking of disease epidemiology, then yes, it will. So I agree with you. And it will depend upon the interests of the researcher. So already the CSRD is working on medical geography and they have a whole body of work which is emerging in this area. So yes,
Thank you. I think there were a couple of questions online. Rashmi had a question in the chat box. I think she also tried to raise her hand. So if you're there, if you can hear us, please do raise your question. And I would like to request, because we are running short of time now, which we sort of did anticipate because there's a lot to talk about. But so maybe you'd like to keep it a little brief when you're posing your question or whatever your point that you're raising. Rashmi, if you want us to read the question out for you, Ajit, can you?
Yes, there are some questions. There is one question by Prashant Ken. He asked why there hasn't been any course on caste and health in the center, given its long history. And there is another question by K. Sebastian, and is it possible to hear from some alumni who were able to practice what they have learned from the center and Dr. Qadeer? And there are for many years goes on and on why this we can't do. Like this is like there are so many questions remain unanswered. So and there are so many if and buts. And there is question from Rasmi, and she did PhD in 2022. And her question is, I just want to ask Imrana ma'am, how we can reconnect to the idea of public health after leaving the center. In reality, there are lots of hierarchies we can see personally as well, adopting health for all. When it comes to girls/women's health, society is still far from the idea of universal health. So how can we establish a fair treatment for them personally as well as policymakers? And
I think we can answer these for now.
I think these are the major questions.
My answer will be so repetitive. How do you reconnect? See, everyone wants ready-made answers to these dilemmas. How do you reconnect with the notion of public health? One is to reconnect at the level of ideas, and you can always reconnect by reading, by writing to your friends. And the other is, how do you reconnect in practice, in your work? And it will depend upon where you are working, what you are doing. So I would really, it's every individual will have to answer this question individually. Honestly, I had a dream, and my dream was that those students who go out from this center and who are really passionate about following it up will be ready to invest time and resources to connect and develop a platform. And to me, in today's times and the kind of constraints we live in, that's the only way. There's no way funding is going to be provided for CSMCH students outside the university to connect. The center itself is having problems, so that kind of thing is not easy. In fact, in sometimes it might become even dangerous to connect because I know that very exclusively participation of people from this center with other institutions is not being encouraged. I have personal experience of this, and I know that this is not. So please don't throw up idealistic questions. You should know what kind of world you are living in, and you should know how much you care for public health to invest and to take risks. If you are, I'm sure you will find a way.
Thank you, ma'am. I don't see any questions there, but I do see a comment there. Ajit, if you could read that out for us.
Jagadishan has his hands up.
Jagadishan, okay. Jagadishan is there online.
Yeah, please go ahead. Please go ahead with your question and do introduce yourself to us first.
Hello, Imrana Madam and senior colleagues and friends. This is not a question, Madam. At this point of time, I am not here to pose any questions. I know very well that we have so many questions and that we will share each other when I am visiting Delhi. So this is a great occasion for me. This is a great occasion for me. Fortunately, in your book publishing function, I was in Delhi in the same committee room. I joined that meeting that day. And this again, for me, a center, just in few words, I would like to share my feeling. What was center in my life or our life since Tracy is with me. So center was always a strength for all of us, though we are very, very far away from the center in faraway places like Kerala and all. So the point I joined JNU, after completing my course, there was so much of confusion, even at that point of time, early 80s or early 80s or middle of 80s. So after some of the failed attempts to develop some public health programs for at the community level and all, we identify. Even before that time, we know Center and Imrana Madam, Banerjee Sab and all, through your articles in Medical Front Circle bulletins and the book In Search of Diagnosis and that type of books. And so, but as everybody said, while joining the center, Madam made that point very clear. You are that activist stream or that lineage will not give you any shortcut to the academics of public health, for which you must study the public health thoroughly. You must develop your methods, your approach, everything. So center providers us. It was a fantastic period. Early 90s JNU was fantastic. For me, it was second fantastic campus life after Calicut Medical College, and I could not forget those days. And initial days, of course, there would be some managerial issues, problems, and always Madam and senior faculty members were with us, since we are from faraway places, and even for accommodation, we had problems. And also, so in short, I know we are running short of time. Center provided us the type of clarity, the type of academic backup, and the type of foundation to look upon the public health issues, not just for a state, but for the country. So that was fantastic. And all the aspects which we were discussing, like the field visit in Rajasthan, in Delhi urban area, all these were very, very, very valuable in our life. And most important thing is that since I was working with, after leaving the center in 1997, I was working with the Kerala Health Service. Around 26 years I worked. And that center provided me that perspective to how to develop a health system, how to make an effort to transform the governmental health system for people's needs, healthcare needs of the peoples, especially the primary healthcare. It was not always very easy, and it was always not a smooth sort of thing. But in the end, we had some good result also. Last end of my tenure in government service, we had that Ardhra mission, comprehensive primary care project, and also. I am not going into such details, but my critical point is that the center always was behind us. In everybody's life, there will be some people, some centers, some institutions, some some what else? Some beliefs that will provide them courage, that will provide them some clarity in their life. So center is like that for us. So it's a great center, and we should continue. At this point of time, we must have a vision for our center. What should be our center after 50 years? And our center, though, this point also I would like to make clear. In between, I had opportunity to meet so many students or so many who completed the public health courses from different parts of the country. Now, there are so many public health courses all around the country and abroad. But the type of perspectives which were developed, which were inculcated in our center, it was always not seen in many centers. There are many public health institutions all over the country. So best wishes for Madam and these three, Madam Dr. Banerjee and the other madam who developed such a fantastic center and such a fantastic university. We'll have tough times in our life, and in history always there were tougher times even earlier also, but we will overcome this. We shall overcome this tough time together. That's my belief, and with that belief and those words, wish you all best, and thank you so much.
Again.
Sir, can you tell us a little bit about yourself?
Oh, sorry, I forgotten to tell that. I joined the center in 1993. So till 1997, we were there. Tracy was always with me, and she was in the MPhil stream, and I was in the MCH stream, and so it was fantastic. I still remember those classrooms. 601 still with so much of, I would say that coursework we could recollect, or the type of discussions which Imrana Madam was taking us to the whole, the sky is our limit. Those were the terms which we were using those times, and not just public health, all the type of discipline, economics, philosophy, sociology, everything. So sorry for again taking more time. So till to 1997, we were there, and I left in 1997. I joined Kerala Health Services. So Thresia continued, and she completed her PhD. No, but always JNU was behind me, and so while going daily for meetings and all, I was always visit JNU and talk to our faculty. So early 2000 again I restarted, since it was deregistered, and early 2000 I completed my PhD. I am very happy that I could complete that. If I go details, there are so many things. Imrana Madam, that one article on Kerala Health that criticizing linking the factors as causative linkages. I still remember those words, and still it was great for my thesis also. So that was it. 97 I joined, and health service I was working with, somehow I was lifted to the district level, and around 20 years I worked with the Directorate of Health Service, just below 20 years. So I was holding, mostly last years I was holding the charge of Deputy Director Planning, and more than 1 year for Additional Director Planning, and I was the nodal officer for this Ardhra mission that was implemented last year, last government's period, and it's still continuing. So that's in short.
Thank you, sir. Okay, I think, there's another, there are two questions in the room. Okay.
It's not a question, it's just a sharing to address Sebastian's question also. How much time do we have? I might take 4 to 5 minutes.
We don't have a lot of time. I'm going to be honest. I wish we did, but we don't.
So nice.
Very quickly, then I'll answer. Very quickly, I'll answer to Sebastian's question. Like, what has shaped this center as a public health professional in my particular case? So I'm Hari. I'm from the 1993 batch, that's changing 90s batch. 93 to 2000. I see a couple of my, classmates, Teresa and Dr. Jagdishan. We call him only Apu, and Dr. KK is also there, my immediate junior. And two things I would like to highlight. One is about the critical thinking or questioning. For that, obviously, one has to do a thorough reading, so which has given that kind of training. This center has given such kind of training in my particular case, where during MPhil, we all had gone through that trauma of terrifying reading, never-ending readings, because everyone came as an OS to this center. I come from anthropological background. To understand what is community health, I had to read about psychology, economics, and political economy also. So I did take a lot of effort in reading. And after MPhil and after submitting my MPhil thesis and all, I was happy. The reading part is over. Then the actual stage had come. That next one is the PhD synopsis preparation. And even after that, while writing the PhD thesis also, I will not name the supervisor, my supervisor's name, but you can easily figure out. So each time I submit a draft, that supervisor will give me some more reading list, and that person will not tell you what was lacking. I have to do that reading and figure out what is missing in my own draft. Then I have to come up with a new draft. So like that I have done, I have written 8 drafts for my PhD. Then finally I gave myself and said, I cannot do any justice beyond this. So luckily supervisor very generous, and she had helped me. So you know the gender at least now. So, but that had helped me a lot in reading, thorough reading and all. I just saw Rajesh sir here. He is my senior colleague and a very senior bureaucrat. When I started working in HIV and Development Center, I worked a lot in HIV. Again, they work on the social determinants of health. So all these aspects which was taught in the center was applied in that area. So accordingly, we used to prepare programs for the communities. What is exactly stopping them to access having a better quality of life? So how we can improve that? There we have been. I could be more useful in that UN system. And Rajesh sir, what I was mentioning is when I started working with NACO in the stream of mainstreaming of HIV. So that time when SCP-4 was brought out, it's a solid 400 to 500 page volume program talking about entire components of the national HIV control program. So apart from him, because he was coordinating all the section heads meeting to see whether they want to add some more to the policy or the program. Apart from him, I was the only one who read the entire policy document. I had come up with some suggestions with my little whatever understanding of the program. And HIV, mainstreaming of HIV is also the kind of program we had during the center, multidisciplinary or interdisciplinary. Why should all the disciplines should focus or contribute to public health? And helped me in that mainstreaming HIV, because we were supposed to mainstream all the government ministries and NGOs and private sector to address HIV, because it's a very difficult task to go to an NGO who's working on child development, tell them you need to address HIV also. So first we need to look at the linkages. Though I was reading the program, I had to have at least an understanding of what kind of programs they're running and where we can incorporate HIV. So that kind of training that kind of foundation was built during my MPhil PhD days in this center. My last thing, last year during COVID second wave, I went as public health specialist to Bombay Municipal Corporation. And many of you know Bombay Municipal Corporation has done a wonderful job in preventing controlling the COVID epidemic in the Bombay city. It's not the same in other parts of Maharashtra. But they were, the assistant commissioner had, during the briefing, he said, we don't want to be complacent that we have done a fabulous job. We want you to go into the field and tell us what kind of strengthening points we can adapt. So that's where my people perspective training had come in handy. Just to give one example of a recommendation I gave to BMC, that during the vaccination period, everyone's supposed to book online for the vaccination slots. And what are the people living in slums and poor people who doesn't have to access of to phone, smartphone or computer or laptop? They were at a disadvantaged position, so they cannot actually enroll or book the slot for vaccination. So I suggested they should be at the hospital. They should be given a token, that to staggered tokens. Every 2 hours, we can give tokens to these people so that they can book the slot. So that training wouldn't have come unless Professor Imrana Qadeer ma'am or other faculty members who had grilled us during that time to instill that people perspective of thinking. So if we don't have that kind of thinking, we cannot step into the shoes and look at what kind of problems they face. So thank you very much for the time, and I'm happy to meet so many professors and senior faculty and a lot of former colleagues, seniors and my juniors and our classmates. Thank you very much for this vacation. Bye.
Thank you, sir. Two people wanted to ask or speak rather, either way.
Indira?
Thanks. I won't take much time.
Yes, once again.
Yeah. Thanks. So I'm Indira, and I joined as a direct PhD student in 2000. I joined at the age of 40. I already had 2 daughters, but yeah, I mean that's just to give an idea of the kind of ethos that JNU and the center has had at that time. I'm sure it still continues to have it. So I had already met Professor Qadeer. I was working on a book with her, and I got interested. I came as a scientist, so I was interested in technology and public health and so on. And it was wonderful. And in fact, the 2 questions, the 2 points that were told to Professor Ritu Priya when she wanted to join, the exact same words were told to me also. That I will have to do the 3 semesters of coursework. I will have to attend classes. So I tried and attended classes with 20-year-olds. And anyway, that's a long story. I don't want to go into that. I just have 2 very specific questions. That again, because of the discussions that I had with Imrana during my PhD. So one, to look at things that did not work, to look at technologies that failed in public health, I'm applying those same line of thinking. I just want to, I have 2 questions, not just for Imrana, but as she said, for everyone here. One is, what happened to the course that you were teaching on workers' health, and why did that? Whatever, what happened to that is a question that I have. And because I personally feel, having gone through the history of public health and medicine and medical technology, that is so relevant now. And the second important question, when you captured the whole transition of public health from what was local and the indigenous public health to global health, and what at that time we always kept calling as technocentric, right? That term I think has gone out from public health. If I'm, I could be wrong, but at that time we, because I understood a lot since my thesis was about technology, medicine, and public health. So this transition now to with a very technocentric public health, Now, in that context, I feel, did the center think about developing a critical perspective on technology? Technology being so central in public health, it always was, and it has only increased now, So, I mean, it was a question, and I think, I don't know whether the answer lies in what Imrana shared about the problems that you all had in framing many of the courses in public health. The whole tussle between social scientists and you all as medical practitioners, does the answer lie somewhere there? Could the center have helped develop a critical perspective on technology? While doing my thesis, I felt, should that also have been an important part in developing the courses in health within the center. That's all, yeah.
Thank you, ma'am. Ma'am, would you like to address that?
This is not a question to me, actually. I think it's the center. For the center to think about. I know the problems the center has, and I think I said also that, the teaching space is withdrawing. It's shrinking more and more, and the core subjects itself are getting hard pressed, and therefore to expand is our problem. But I think the point Indra is making is even more relevant in today's time, because as I said, we cannot reject technology and just be happy. We have to address the present kind of technology, and we have to articulate what is our vision of technology, what is our choice of technology. So what are the alternatives? And I think it's a very, very critical question. And if not as a separate cause I think this challenge can be incorporated in each and every course. Like if you are talking of communicable diseases, I mean, how has technology transformed from one phase into another? I mean, and how it is now becoming so technocentric, and what is the alternative? So one is to have a separate cause, and the other is to see how much of it can be incorporated into the existing courses. And third is that if someone like you gets excited about taking this for a PhD challenge, then let individuals take up this issue and take your work forward. And I think I really admire your work, and you know that. And I think people should read some of the older PhD theses produced by this center, which are yet to be published. Yes. They are very, very important, and a great contribution to public health. And the point earlier Indra was making, this whole thing that if you look at the history of technology, and this is for you, history of technology, so read her thesis. The choice of technology, how do systems choose certain technologies and reject others? Because in every phase you find that different scientists are working, different institutions are throwing up answers. And out of those answers, some answers are selected. Like there are many kinds of public health perspectives. And certain perspectives are chosen by the larger political system. And why does that happen? And can we now look at the other rejected technologies and ideas and say, okay, let's bring them back.
Thank you, ma'am. I think there was one more question at the back.
No.
Okay.
Yeah. So I belong to the last batch of students.
Yeah, go ahead.
Yes. I belong to the last batch of students, that's 2005 batch, whom Imrana ma'am taught. And we had a shared classroom of Imrana and Imrana Qadeer, where we are part of in 601. And probably I was the only student who comes from a legal studies background. I did my master's in law. So I was kind of a difficult person in the class in a way. They don't know.
कितना टाइम लगेगा? बात करूं, कॉल करूं?
I
पूछ लेती हूँ.
Can't hear you, Aarti.
So we belong to the last batch of students who taught her, and we had the classroom experience. I would say those who missed that, it's a great trip. And we used to say that Imrana used to come to the class with an AK-47, and then she wanted us to answer. She asked questions, and she wanted us to answer the same exact answer that was in her mind. And especially for doctors, it was kind of a very tough time, especially when she was teaching social stratification. Certain answers definitely would be caste and inequality based on caste, which is very difficult for a person from a medical background to come up with. And in the classroom, eventually we realized as a class how we transformed. And especially we were looking at the medicos who were completely turning to be a social scientist, and that was the beauty of the coursework which we were all part of. And I just want to be very thankful to the center and the entire faculty here for what we are now, and for giving us certain particular reasons I have. One is about the first question. I still remember after the orientation, Imrana came to the class and she was asking the question, how many of you are political? So there were only 3 hands raised. And until then, I was part of a legal studies department where you have to be politically neutral always. And you have to hide your politics like a wound. So I was always a supportive person in my law classrooms. And this is the first classroom I thought like, okay, I can raise my hand being a political person. And the question she reverted kind of in very accusing others. So rest of you are apolitical? That question was so sharp and we were all like, okay, being apolitical is something wrong. So that was kind of a message. And then eventually we realized that, and the way she ended in today's speech also, being political is only the way you can understand public health in its core. So that was kind of an academic prerequisite. One could learn public health. That we realized later on. But that was kind of a relieving moment for people like us. And another thing is about the way, the kind of asking questions in the classroom and forced us to think. And being a teacher now, I teach in Mahatma Gandhi University, Kottayam. And it is such a difficult task to make our students think. And probably to an extent, I learned from all my faculties here to make us think. And the way we think today, I think we all are indebted to the faculty here and especially to Imrana. And the way we are looking into the fact that what is the importance of history. So being a student from law, being the students from other disciplines, we were in that having that historical perspective. So the relevance of history to understand the present and to plan for the future, we learn from this center, and we are really, really thankful to the center. And about subjective biases. That was if you're doing a research, it's kind of I would say it's kind of a big burden on you because you try all your level to mask your subjective biases. So this center taught us you can have your subjective biases. I still remember Alpana saying that you put your biases on table. So that was also again a relief that, okay, we can have our own biases, and that biases has its own history and politics and sociology. So it can train us being researchers that we can have our own biases and then talk about our own biases is also part of our methodology. That was such a kind of a revelating moment, I would say. And especially the comprehensive idea of public health. And looking into each and every single moment in our life and relating that to the question of public health. If you look into poverty, if you look into caste discrimination and question of dignity, then you see public health as a comprehensive idea, which is actually, I think, nowhere in India we at that time we used to get. And now we teach in undergrad level also. I offer an elective course in social medicine and community health, and my students wanted to go for PG courses in social medicine. So unfortunately, we don't have a PG course in social medicine in this country. And coming to the 50th year of the center, I think it's very important what Imrana is always good at, to have a collective sense of working together. So I think we need to brainstorm a bit more. I think at some point of time, when I joined in 2005, I always wanted to work with Imrana Qadeer. Then the same year she got retired. The same year I submitted my PhD. Rest of my 7 years, we were working together as colleagues. And I think you have every reason you can be envious of me because I had a lot of share of her. And when I missed that, I became deeply depressed, clinically depressed. Then I moved back to Kerala. And she is always the person who is pinning me in my WhatsApp chat. What are you doing? Tell me. Because I become completely this distance I wasn't able to deal with. Still I'm struggling. But I think she is the person who can understand, like everyone others was talking about, the limitation of you. And she found my communication from distance as a limitation of myself. And she was the one who was taking lead in continuing that relationship. So until I reached to the social medicine center, the teacher models I had, as always, I feel like I don't want to be a teacher like that. That was the role model until my LLM classes. And when I reached here, I would say every teacher, the comparative health system classes, the Mabaru used to take. So I learned how we can, she was the one who taught us, don't skip the tables. And she taught us how to read tables in every single class of all other faculties, which is actually influenced us, and probably we have a team of role models as teachers here. And being a teacher, I'm really, really thankful to all my teachers, and I'm using this opportunity to thank. And coming back to the collective work, which me and Imrana, we were discussing, and at our earlier stage of our working together, can we think of at least go back and revisit those 19 villages, which I was discussing with Ramon also, and I think Center also had that plans. So at least can we think of something like that, so that we can all work coming 50th year coming back and work together. I think working together is the only way out to deal this dark time. And one personal experience, I have a lot of personal experience coming in, but one thing which I learned is the perpetual studentship of Imrana. Like you can continuously be a student, getting excited with ideas, sharing those ideas, exploring those ideas. And to the core, if you want to be a good academic, if you want to be a good teacher, first of all, you have to be a good human being. That also what we learned from her. And I think we all are indebted to, this might be a very common understanding, but it's not a common thing to live in with, or having a practical model before our students and research scholars. So we are thankful, and I hope Center will plan something so that all of us can, all the online people here, they were also worrying that we are all in isolation and we're not in a position to come in together. And definitely, I agree with you, we will take our effort to come together. Thank you.
Thank you so much, ma'am. Am I audible? Okay, we have a few people online who wanted to speak. Please feel free to unmute yourself, introduce yourself, please, and do go ahead with what you wanted to share with us.
Yes. Hello. Hello.
Yes, sir. Please go ahead. We can hear you.
Hello. Am I audible?
Yes, you are. Yes, you are.
Good afternoon, everybody. I am Dr. H.K. Das. I am a 2002 batch, completed my MPH from JNU with CSMCH. At present, I work with ICMR, being a regional center at Dibrugarh. And since last almost 29 years, I'm working with the ICMR Center. I'm grateful to the faculty members. My guide or mentor was Dr. Sangamita Acharya, and who taught me the essence of the health systems, the health service system, and the health delivery system. Because being a physician, that part was not clear in me before I joined JNU. And when I came out, these are the same words we usually use during my practice period. And I am very much thankful to them and my faculty members for giving me that opportunity and for the way that things we have to deal with the present situation. Thankful to you all. I have a small question is that to Imrana ma'am. Ma'am, what is your take on the UHC? I mean to say universal health coverages in relation to public health. Thank you.
Book a reference.
My take is I don't know what to say.
Read the book.
We did together write a book on universal health care. It might have started as a positive thought, as a notion, but today I think UHC has become a smoke screen to get the same technocentric back into power. And I believe my challenge is to argue that we talk of universal health care because part of the elite in this country already have everything. The others don't have anything. And by talking of UHC in a biotechnologically oriented public health, you get more technology and you give it to the same people who already have things. So you have to talk of basic services. You have to talk of what is today lost, which is primary health care, and critique universal health care.
Tap side करो जिससे ये
So now this is being hijacked by a case. We're taking a pause from all the very academic discussion and we're moving on to the cake cutting. Thank you so much to everyone. My apologies to everybody who still had more questions. We'll take those questions later on. अभी केक काटते हैं, सेलिब्रेट करने आए हैं, सेलिब्रेट करते हैं, चर्चा चलती रहेगी.
Cake पे चर्चा. Good one. And apologies to those who are online that we can't share it with you. से कमरे में नहीं आ पाती.
ये बड़ा स्टाइलिश है.
Songs.
But we'll keep it a secret.
Acha, who is the youngest family
here?
Prachi or Tian, one of the two.
Because this is a birthday for the center. And therefore, orders.
You can at least blow the candles. Yes.
Happy birthday.
Those candles which never go.
Happy birthday, ma'am.
Happy birthday. Happy birthday to you. Happy birthday. Happy birthday to you.
हाथ से खिलाओ, हाथ से खिलाओ।
Happy birthday to you. Happy birthday to ma'am. Happy birthday to
Happy birthday to Professor Imrana Qadeer from Dr. Sudhir Kumar, 95. Thank you. And we wish you a very long life, happy life, healthy life. And always we expect a guidelines from you for our good professional life. Thank you very much to all.
Now, since you're cutting the cake, might as well
So while Shukarba and Madhuri are there at the mic, I think we can use them to hear a couple of more songs while we are arranging the cake.
And the lunch. Lunch is also ready. Yes.
He'll cut it.
Yes.
Yeah. Distribute. Yeah.
Can somebody help with this?
Yeah.
Center side.
यहाँ से ले जाते हैं साइड से। हाँ उधर से जाते हैं।
कोई एक का पिक्चर पोस्ट करेंगे?
Ma'am, one song they wanted to present. उसके बाद हम
Just announce because
we will be proceeding to lunch shortly. Right now, we have a short song being presented by Madhuri and Shukarba.
कहीं दूर जब दिन ढल जाए, साँझ की दुल्हन बदन चुराए चुपके से आए, मेरे ख्यालों के आंगन में कोई सपनों के दीप जलाए, दीप जलाए। कहीं दूर जब दिन ढल जाए, साँझ की दुल्हन बदन चुराए चुपके से आए, আমার প্রশ্ন করে ধ্রুব তারা, আর কত কাল আমি রব দিশাহারা, রব দিশাহারা। জবাব কিছুই তার দিতে পারি নাই, শুধু পথ খুঁজে কেটে গেল এ জীবন সারা, এ জীবন সারা। আমায় প্রশ্ন করে নীল ধ্রুব তারা, আর কত কাল আমি রব দিশাহারা, রব দিশাহারা। कहीं कोई दिल कहीं मिल नहीं पाते, कहीं से निकल आए जन्मों के नाते, घनी थी उलझन मेरी अपना मन, अपना ही होके सहे दर्द पराए। कहीं दूर जब दिन ढल जाए, साँझ दुल्हन बदन चुराए चुपके से आए, मेरे ख्यालों के आंगन में कोई सपनों के दीप जलाए, दीप जलाए। कहीं दूर जब दिन ढल जाए, साँझ की दुल्हन बदन चुराए चुपके से आए।
Beautiful. Thank you, Madhuri. Thank you, Shukarba. That was lovely.
All right, I see some of us have become a little restless. but I'm sorry, I'm going to take some more time because we have a very important thing to share with you. There's an invitation video that has been prepared, and as ma'am also mentioned, and as we know, this is a sort of Kickstarter to the events of the year. So we would like to share that with everyone, and then I'll get back to you.
The video is not audible.
Oh.
Just a second. Address
Okay.
them and tell them you're trying to
I'll just
tell them you share it.
share the link.
Ajay, just speak to them once.
I shared the link in chat box, and you can watch it on YouTube if you cannot hear or see the video. Thank you.
Thank you for sharing that. The video link will be available in all of the groups and will be forwarded. I believe online had a little bit of an issue with the audio. I hope you can enjoy the video when you watch it online. And I think with that, we are done with all of the formal programs of the day. We have had our discussion, we've learned a lot. We have a lot to think about because a lot of questions, even though ma'am answered, I think it was something for all of us at the center, you know, past, present, and future, as we've named this event, you know, for all of us to really think about and work on together. And I would like to take this moment to thank all the people who have made today possible. That includes all of the staff, the faculty, the students, all those who have volunteered their time and resources to come together. And we're still working on the events that are coming up. So really thanks a lot for coming together, for offering your support. And thank you to ma'am for the opportunity to celebrate you. And we have another little tiny gift for you. This is not really a gift, it's more of an expression. I hope you will like it. I think Pratibha was the one who came up with the idea, and it has a little bit of all of us in this.
Very complex, intricate inside. Wow. Oh. You can take your time, enjoy.
This has to be kind of taken in slowly.
Yes. With your team leading, I really like it.
I think with that, we can start proceeding towards lunch. Lunch will be served towards my left. Please go ahead. Those of you, I think ma'am can also join us. For all those who are online, thanks a lot for joining us. I see that even by the end of say 2-3 hours, we had over 50 people in the call. We still have 42 people, and that goes on to say how interested people were in hearing each other, in hearing ma'am. So a huge round of applause for those who have joined us. Like Ritu ma'am said for the cake, sadly we won't be able to share our lunch with you. But thanks a lot for joining, and we shall now proceed towards lunch. Thank you, everyone.
Thanks to all the students and the entire center. The present students, I mean, it's not just about Calvin and I, all of you also. Thanks to all of you. After lunch, we'll all disperse, you know, so. Yeah.
I'm not saying thank yous to anyone.
Sorry?
I said, I'm not saying thank yous to anyone. But thank you all. I've not been formally given the chance, but thank you for making this big of it. It's really beautiful. I'll remember always. And one thing I want to say, my home is always open. Anyone, anytime wants to come and talk about public health, do that. Thank you.
It's a humble request from